You know, behind every new product, there's an interesting story, and the Barihab is no exception. The Barihab was developed over the course of 12 years by a coda named Edward Estrada, and through his hands-on experience with patients day in and day out, he discovered a new way to treat patients. The Barihab is the culmination of trial and error over the course of 12 years. The following training video, presented by Corey Berkeley, will give you insight as to all of the features and advantages the Barihab provides.
Hi, my name is Corey Berkeley. I'm a practicing physical therapist and the director of a couple of clinics as well. And I am here today to teach you about the Barihab treatment assessment platform. Through this video, we'll be showing you the advantages of the treatment assessment platform, not just for your patients, but for you as well. So let's get started. As we begin, you'll notice the Barihab looks a lot like a standard high-low treatment table. However, when you need additional support for your patient, that's when you'll really notice the benefit of this first feature, the motorized backrest. The backrest is operated simply by using the foot control. Using the foot control here allows you to stay directly in front of your patient, maintaining eye contact with them, and thereby helping to reduce the patient's anxiety during the treatment. The treatment back support is adjustable from 0 to 89 degrees. This allows you to adjust the amount of support that you're offering to your patient, allows you to assess their core stability and strength. You can then adjust the angle of the backrest again to turn your assessment into treatment by reducing that passive support to them. One of the additional values of this is that it helps reduce your need as a therapist to passively support the patient and concentrate more on facilitating movements along with them. Additionally, it reduces the need for co-treatment, thus eliminating additional strain on staff. As a therapist, the use of the backrest for additional support is going to help reduce strain to your own body during the course of the treatment day by assisting with passive support to the patient that you would have traditionally provided to them. Stowed behind the seat back support are the seat belts and neck support. First, the seat belts. Have you ever had this happen to you? You're working with a patient and they begin to slide forward. Well, we have an ingenious solution to that, and that is the seat belts. Using the seat belt, you can easily and simply secure your patient in place, allowing you to focus on your other treatment activities with them while maintaining good postural support. When you're done with the seatbelt, simply unbuckle and stow it behind the seat on the convenient magnetic holders. An additional feature built into the backrest is the neck support. Simply raise the support to the height of the patient and then use the tightening screw to adjust it into place. This feature is quite valuable for speech therapy. It allows positioning of the patient in the correct position for head and neck alignment for working on speech treatments. In order to remove the rest, simply adjust the pillow portion back, untighten the knob, and lower the rest back into position. Now that we've explored the benefits of the back support, the seat belt, and the headrest, we'll move on to the transfer bars. Transfer bars are stowed underneath the table when you don't need them, but when you do need them, they're easily brought out by pressing up lightly on the outer edge of the bar. Slide the bar out. You'll come to a portion, it's a little bit rounded, that will allow you to move this 90 degrees. Slide back into place, and then secure it using the tightening knob underneath. On the bar, you'll notice some numbers that will indicate how far out the bar is from the edge of the treatment table. The value of the transfer bar is it provides a secure handhold for the patient while transferring themselves from a wheelchair to the mat surface. The mat itself is adjustable down to 18.5 inches, which will accommodate most standard wheelchair heights. In the transfer process, the patient is able to use the transfer bar to help assist themselves over to the mat surface. This allows the therapist then to really concentrate their skills on facilitating that movement and being a cheerleader to the patient, as opposed to being a piece of equipment and using their own body to assist the movement. For your patients who may require some additional support, you may also make use of the second transfer bar. It's located on the opposite side of the table. As we did before, simply lift up on the outer edge of the bar, slide it out until you see the rounded portion of the bar, rotate up 90 degrees, and slide in to the correct position, using the numbers on the top of the bar to reference the other side so you're at the same position. A great feature of this, if you have an individual who lacks trunk support, you can use these, sliding them all the way in, and that can help to provide some additional lateral support for that patient during the treatment. As you get to a point where the patient can progress and you want to start working on standing transfers, balance training, these bars can be positioned out. Again, make sure to tighten the knob. And now you're ready to begin your transfer training and balance training. With the transfer bars employed and secured, you're now ready to begin your sit to stand and standing balance training. Rather than traditionally transferring a patient to a wheelchair and over to another apparatus such as parallel bars to do this, you can now simply use the features that are built into the Barihab itself. With the transfer bars, you can have the patient begin working on their sit to stand, using the upper level of the bar set to a similar height that you'd be using with your parallel bars. You can now begin your training right there at the table. If the patient begins to fatigue, you can simply have them return to a sitting position, nice and stable on the table, and continue your treatment from there.